AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening and welcome to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health agency serving Dade, Broward, and Palm Beach counties. You can reach them at 954-717-7027 or info@allcountyhealthcare.com. I am your host, Dawn Graubert, and tonight we get to revisit with Ed Salazar. Ed Salazar is a highly experienced registered respiratory therapist and clinical specialist with over 40 years of dedicated service in South Florida's Tri-County area. Throughout his career, Ed has remained committed to advancing respiratory care and improving the quality of life for patients living with chronic lung conditions. At All County Healthcare, Ed leads the development and implementation of a specialized pulmonary hygiene program, training nurses and healthcare professionals in advanced respiratory therapies. He oversees the organization's exclusive pulmonary hygiene team, delivering innovative, patient-centered care directly in the home setting. Ed specializes in intrapulmonary percussive ventilation, IPV, which is an FDA-approved therapy designed to assist patients with chronic lung disease by improving airway clearance and reducing hospital readmissions. His expertise also spans a wide range of respiratory services, including airway clearance therapy, oxygen therapy education, ventilator management, tracheostomy care, and comprehensive patient and caregiver training. His work plays a vital role in bridging the gap between hospital care and home health, ensuring patients receive high-quality, life-enhancing treatment in the comfort of their own homes. Welcome, Ed.
Well, thank you for having me back.
It's an impressive bio, right?
My goodness.
I know. But you do so many great things. It's really nice to revisit with you again. It's been a while since we've had you here and talked about All County.
Well, it's always a pleasure to be here. And I remain very devoted to All County Healthcare and very, very proud to be a part of that organization.
What's happening with All County? What's new since the summer?
Well, there have been a couple of significant developments. Probably the biggest is that we are no longer exclusively conventional Medicare. We have signed agreements with a couple of Medicare Advantage plans, and I think that will greatly expand the company's outreach. One of the very frustrating things for me working with All County was, as you know, as we've talked about in previous shows, for the first time ever, Medicare Advantage plan holders exceeded conventional Medicare.
I was going to ask you, All County was always straight Medicare.
Straight Medicare,
100%
right.
government, straight Medicare. Why the change? Why the evolution into Medicare Advantage?
Well, primarily because that's where so many people were going. And it's frustrating to me because, and again, this is just my personal opinion, but from what I've seen myself, and I'm on Medicare myself, and what I've seen is that when a Medicare Advantage plan advertises that they can give you better protection, they can give you better services than conventional Medicare, but they're doing it by you assigning your Medicare benefits to them.
Which means, what does that mean?
Well, what that means is, let's say
say I'm on Medicare and
okay.
I'm going to take a Medicare Advantage plan. They ask me to sign
we're going to give you medications. You don't have to get your own Part D. They will give you silver sneakers.
Which sounds great, right?
It
For
does,
me, it sounds great.
It does.
But
how do they do this? Say for treating a COPD patient, the Medicare allowance is $3,500 for an episode. How can a Medicare Advantage plan tell you, well, we'll do it for less? Now, they say, okay, now we have 5,000 lives that we're covering, and we're going to put coverage of those lives out to bid. So if the Medicare allowance is $3,500, what of you doctor groups out there will do it for less? And they keep bidding and bidding and bidding. So essentially, your care is being given to the lowest bidder.
Because they're playing on the fact that the doctors will do it for the numbers because they don't want to lose those heads.
Right. They want the numbers. So they'll take lesser reimbursement for the same
But how does
procedure.
that affect all county?
Well, if we're only taking conventional Medicare, and more people are being lured to the Medicare Advantage programs, then that decreases the population that we can serve.
Is that because the doctors have to refer to you, and if they take the Medicare Advantage, and that referral goes to you, and then change in price also? Because if they're taking a lesser price, does the reimbursement for all county, is that less as well?
Oh, no.
Okay.
No, it's just simply harder to find patients that we are eligible to cover. Another thing that is extremely frustrating, every patient that goes into a hospital, when they're getting ready to be discharged, and if it is deemed necessary for them to receive home care as part of their discharge plan, every patient has the free choice to choose whatever agency they want. But with the proliferation of these corporate hospital ownership, in addition to developing their own hospitalist team, their internal physicians, they're also developing their own DME companies, durable medical equipment companies, and they're developing their own home health agencies. Now, the discharge planners in the hospital, obviously they're going to be encouraged, let's say, to refer patients to the hospital's own home health agency.
And they may do it for continuity of care, however they present it to the patient.
Exactly.
Correct.
Whatever their rationale they present is.
Okay.
But the patient still has choice. But if the patient does not realize, and they're just going to say, well, whatever you think is best, then that's the way things are going to go. The one thing that I will say for a company like All County, if you are not affiliated to any hospital, if you are a true independent home care agency, then what becomes very, very important is your standing with Medicare. In Florida, you're standing with ACA. And any consumer can go to ACA, and they can, with a simple search, they can find out if a Medicare home health agency has ever had any sanctions against them, if they've ever received any fines. One of the things that I'm impressed by and I'm very proud of is that very, very frequently with All County, we'll get somebody that moves into Florida. There's a lot of that going on right now, right?
Exactly. Yeah, season is here, right? So people are coming down.
Right. And so you get someone who they say, okay, well, let's call Medicare, or get in touch with ACA, and let's see, is there a home health agency you would recommend? And we frequently get recommendations from these organizations, ACA, Medicare itself, and the fact that we are not affiliated with any hospital group speaks volumes for our record and our reputation.
Personally, I know All County has done incredibly great services for my family, for my parents. They've always been there with everything from home health care to anything they need to somebody living in, to treatment, post-cardiac care. But what you do for respiratory care, nobody else is doing. So besides the reimbursement, right, that's Medicare and Medicare Advantage to the side, the services that specifically you and your pulmonary hygiene team provide, no one else has.
That's correct.
Well, let's talk about that, like the services that are offered and why go to All County and why use your team.
Very, very briefly, and I know we've talked about this on previous programs, but I've been with All County now for 18 years.
Wow.
And at that time, 18 years ago, I was a distributor for the manufacturer of the IPV equipment, the intrapulmonary percussive ventilation equipment. And I was trying to position it, you know, and I thought home care would be a great place to be positioned, because then you could have true continuity of care, transitional care from ICU to floor care to discharge home. And if someone had been admitted for an exacerbation of a chronic lung condition, we could give them the same quality of care at home that they had received in the hospital. I said, this makes common sense. So I went to a number of home health agencies, and I started with the largest national companies. Everybody thought it was a great idea until they found out what the acquisition cost of the equipment was. And it wasn't such a good idea.
Of course.
It didn't fit their business model. My wife was the director of nurses, and you know, she said, well, could you teach nurses to do this? And I said, of course, you know, I could teach nurses. So she went to Lou Biazzi, who was the primary principal at All County at the time, and he listened to her. He asked her, will this make us money? I said, don't know. He says, will it help the patients? I said, absolutely. So he said, well, let's try it. So he, just on that, Lou bought a couple machines, and we tried it. Very, very rapidly, we started keeping all those machines busy. You know, I've been a respiratory therapist for almost 50 years now in South Florida, so I know a lot of pulmonologists. And we had those machines humming all the time. We were having very, very positive outcomes. Bought a few more machines, and that's how I became pretty much the resident therapist.
You tell me,
for All County.
you think All County is the only home health care agency with a full-time registered respiratory therapist on staff, I guess?
To the best of my knowledge, and if anyone listening can prove me wrong, please do. But to the best of my knowledge, All County is the only one with a staff registered respiratory therapist, because Medicare, in their infinite wisdom, continues not to pay for a respiratory therapist in home care. But Lou said, if we're going to create this pulmonary hygiene program, then I want a qualified person to train the nurses and to supervise them.
Why is it called, because I asked you before the show, I wanted to make sure I got the terminology right. Why is it called a pulmonary hygiene program instead of respiratory therapy? Why the hygiene?
Well, because the primary objective of the treatment, the therapy that we use, is for airway clearance, to mobilize secretions in patients with, it doesn't necessarily have to be COPD. There are a lot of different types of chronic lung conditions. Some of them are secondary to a neuromuscular problem like Duchenne's muscular dystrophy or something like that, where people, and ALS, where people, through loss of muscle control and everything else, they cannot produce a strong spontaneous cough. So the objective of this type of therapy, it's a form of high frequency ventilation, and what it will do, it will promote airway clearance, and at the same time lost lung volume can be recruited, and that's pulmonary hygiene.
It's interesting. We spoke last time you were here about pulmonary hygiene and cardiac care, and how there is, one relies on the other, right? You need the good pulmonary hygiene to keep the blood flowing, to keep your cardiac output at a higher output.
Correct. And many, many times, if your lungs start getting really congested, then that puts a strain on your heart, puts a strain on the both sides of the heart eventually.
So there's so many, other than just the COPD, because I'm thinking people that are listening, they're going to say, all right, do I qualify? What are my symptoms? What are my mom and dad's symptoms? That maybe I call All County and say, can you help with this respiratory issue that we're having? So neuromuscular, you talked about Duchenne's, you talk about COPD.
Cerebral palsy, ALS, and of course, chronic lung disease, pulmonary fibrosis, idiopathic pulmonary fibrosis. We have, every time we get a case that is very medically complex and we have a good outcome, I always ask the family or the patient or the physician, the clinician, if they would write us a letter, like an endorsement. And I've got a very substantial file.
Ed's been doing this a long time. Okay,
Yes,
we're going to take a quick commercial break. More to come with You and Your Doctor, sponsored by All County Healthcare on the other side of this commercial break, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health care agency serving Dade, Broward, and Palm Beach County. Check out their website at allcountyhealthcare.com or info@allcountyhealthcare.com. You can also give them a call, 954-717-7027. Tonight we're here with registered respiratory therapist Ed Salazar. We're talking about the benefits of using All County Healthcare with their IPV machine and their pulmonary hygiene therapy team. I want to ask you, Ed, why is the team approach, because you can't go to every house. You've trained the nurses, you've trained staff. Why is the team approach so important and unique with All County Healthcare?
Well, in some of our recent success stories, the fact that All County also has a sister company, a staffing agency. You know, they're All County Staffing Services, and it's like a nursing registry. So if there's a situation where they need extended nursing assistance, you know, we can provide it. All County has also developed a relationship with a very, very highly respected and very versatile concierge home health agency. And as you know, I know you've talked about this before too. Concierge services are on the rise, you know, for a lot of different reasons. But we can do crossover teamwork between the established services that All County has to offer, you know, wound care, diabetic care, all these other things in addition to pulmonary hygiene. And then we can do crossover with if someone needs a caregiver in the home for 4 hours a day, 8 hours a day, you know, we can do that through the nurse registry, you know, the staffing. And if you have someone who is fortunate enough to have the means to procure the more sophisticated home health services to prevent them from having to require hospitalization, then we have the ability to draw on that through a concierge program.
The continuity of care is so important.
Absolutely.
And All County, you're right, makes it so much easier because your doctor or your loved one's doctor sends over what services that they need. And All County can do everything from PT, OT, respiratory therapist, to the staffing, to having someone live at home. And for you, for your spouse, for your kids that know that mom or dad are taken care of, or your spouse is taken care of, and that burden does not fall on you to have to do the toileting, the changing, the showering, the mobility exercises in bed, to make that phone call to All County and say, I need help, I've got one more therapy we need, takes a huge burden off anybody to know that.
Absolutely.
And the quality of care is so top notch, right? You call ACA and they're going to say, all right, you should call All County Healthcare, but not just for one service, all of the services they provide. Right. You've been there 18 years. You have to see, right, the level of care, or you still wouldn't be there with your level of knowledge.
Well, thank you for saying that, and you're absolutely right. In the 18 years that I've been affiliated with All County Healthcare, we have never once been fined or sanctioned by ACA, the Florida Department of Health, Medicare, none of them. And we have never failed to receive, not to receive, a top rating from our JACO inspections. The Joint Commission on Hospital Accreditation, they also survey home health agencies. So, that says a lot.
It says a lot, because for some reason there seems to be a lot of home health care agencies. I want to say popping up, because I know it takes a lot of work to create a business and to have a home health care agency. It has to be harder to keep hold of that niche in the community, even when you've been around for as long as All County has. But because your surveys have always been top notch, and because you have such top ratings, they're here to stay. And the quality of caregivers, because you have a nursing registry, a staffing registry. Can you tell people what that means and why that's so important?
Well, if your doctor orders, home health for you, they want you they want you to have PT, they want you to have occupational therapy, the wound care, things like that. If your condition is more complex than what Medicare guidelines will generally provide for, you have the option of either trying to do without, see if you can find a family member to do it, or be rehospitalized. But if instead of that we can integrate, extended nursing services into the home, you can prevent any of those problems. We at least have a pathway for that option being possible.
Because you have nursing services as well as CNA services.
Correct.
Because if you need someone to live in to do all of that work, the cleaning, the bathing, toileting, you don't necessarily need a nurse for that.
Correct.
So you may have a CNA or somebody trained that can do that, and All County has that, as well as the nursing that can come in and clear a trach, to come in and do the IPV, to come in and do wound care.
Mm-hmm. Correct. And we have some very, very fine people. The nurses that I work with personally on our pulmonary hygiene program, they do things that are way above and beyond the call of duty, and they do them on a regular basis. The other thing that I like about our policy and philosophy, by reputation, a lot of programs have kind of a five and done rule. If they can't see you in 5 visits and discharge you, then their profit margins may be down. And I can speak for the pulmonary hygiene program. We do many, many more visits than 5 to a patient's home to ensure that they get the outcome, they get the benefit that the physician was looking for. And the philosophy of All County has always been, if that diminishes our profit margin, so be it. And we continue to survive and we continue to thrive.
And the differences we spoke about earlier between Medicare and Medicare Advantage, would that change the amount of visits that a patient might qualify for or allotted?
To my knowledge, yes.
So you want people, check with your plan. Check with your parents' plan, check with your spouse's plan to make sure that what you need is going to be covered when you need it.
All they need to ask is for a certification episode, which under Medicare is 60 days. For that certification episode, how many visits am I entitled to? And see if they'll give you a definite answer, yes or no, or give you a number. many times it's something to just kind of dash around. Well, we'll see how it goes, and then we'll, you know.
But when you're in the middle of the treatment, it's important to know what you have. All right, so before we wrap up, if you could leave our listeners with one message about lung health, what would it be?
Well, since COVID, there have been a lot more attention drawn to that. And one thing that did come out of COVID, now the average person knows what a respiratory therapist is.
True.
And that's good and bad, But do not minimize, do not try to put behind you any change in your condition, any change in your ability to breathe, any disruption in your ability to good night's sleep, any change in sputum production, any of these things that you can't explain. Get in contact with your primary care physician.
Even shortness of breath, right?
Yes.
I mean, people may think it's cardiac. It may not be cardiac.
Correct.
It might be pulmonary.
Correct. I have a family member myself who didn't have a productive cough, didn't wheeze, but was getting progressively short of breath. Ignored it, trying to be tough, only to find out that it was pulmonary fibrosis, which has a very, very poor prognosis. But like so many of these things, early diagnosis and early intervention, greatly changes outcomes.
With everything. Ed, thank you so much for joining us. Thank you for the update. It's been way too long. Ed.
Anytime.
Ed Salazar, always a special guest with us at All County. All right, thank you for joining us. Thank you for watching You and Your Doctor, sponsored by All County Healthcare. Again, for more information, you can reach them at 954-717-7027 or info@allcountyhealthcare.com. Have a great evening, everyone. Until next week, I'm Dawn Graubert, and we'll see you then. Have a great night.